Okay, eyelid surgery, also called blepharoplasties. This is one of the most common operations I do. Often patients are in their 40s, and it might be one of the first things that they do cosmetically for their face because their signs of aging tend to start in the eyelids. And often I'm doing the upper and lower eyelids. This is a 44-year-old woman. You can see that her upper lids are quite heavy, makes her look tired. Here she is after the surgery. I've also done her lower lids. I've reduced the bagginess of the lower lids, and she's had laser resurfacing around her eyes. So you can see she looks more youthful, still looks like her, but a more youthful look, more alert, not as tired. The incisions on eyelids heal very well. The one in the upper eyelid is concealed within the crease. Now in this case, I actually made the incision on the inside of her eyelid, so it's not even visible. Now if I have an older patient, maybe in their 50s, I'll make an incision along the eyelash margin because I need to do a tuck. I do need to remove some extra loose skin. Often patients will have some laser resurfacing at the same time to help that crepiness, the small fine lines. And it's very common to do facial fat injection where I use some fat, the patient's fat, and I inject it into the tear trough to try to smooth that lid-cheek junction so that we don't see a well-demarcated eyelid. That's a sign of youth where you almost don't look like you have a lower eyelid. So that's very common as well, and I'll often do the smile creases and the lips. So a very common procedure, not very painful, reliable, very few complications.